So I've been seeing a lot of YouTube comments in particular now that I've been getting on YouTube more regularly, but Instagram comments for the past 3 years where they'll describe their recovery and then say, but my doctor said this and Google said that, and what should I believe? Because Google isn't matching my experience. My doctor isn't really being very helpful. So I don't know what's going on. So in particular, there was an individual who commented on one of my videos and said, hey, it's been 28 days since my concussion. Things still suck, but they're getting better. And my doctor said it should only take a few more weeks and I'll be good. But Google isn't matching. When I Google it, it's not matching what I experience. And so what's going on? What's the discrepancy between patient experience and what Google says? And so I was interested. I had early access to Bard, Google's new AI tool. And I took a screenshot here of what Bard had said when I said, how long does it take for a concussion recovery? Where are we at? So I asked Bard, how long does it typically take for an acute concussion to heal? And Bard said, approximately 80% of concussions resolve over 7 to 14 days with an average of 10 days. People with concussion should never return to sports or other physical activities sooner than 1 week from sustaining the injury. The acute phase of concussion is the initial period after sustaining the injury in which the patient is still experiencing symptoms. This phase can last a week or more. During the acute phase, the concussed brain requires mental and physical rest to recover from the injury. The recovery phase of concussion is the period after the acute phase in which the patient is no longer experiencing symptoms. This phase can last for several weeks or even months. During the recovery phase, the concussed brain continues to heal and regain function. If you have concussion, it's important to rest and avoid activities that could make your symptoms worse. You should also see a doctor to get evaluated and make sure that you're recovering properly. Now, I'm in the concussion space. I am a concussion specialist. This is what I do every day. And that answer even confused me a little bit. So let's break down. It confused me in terms of, well, what do I expect? Several weeks or several months or 7 days or 10 days? Like, what should I expect? So let's break down the research and then sprinkle in my clinical and basically patient experiences through my clinical practice. So let's start with sports-related concussion because that's where most of the concussion research is. Or most of the hype around concussion is around sports. So in sports-related concussion, when you look at the studies and you look at research on recovery timelines, for the most part, the standard is 21 days. 21 days being, if it takes longer than 21 days, it's considered delayed. Now, my patient experience with sports-related concussion is that it is not uncommon for return to play time, so full, complete recovery, like dynamic exertion, tolerance, and you're back in the game. So from time of injury to back in the game, research says it should be 21 days, and if it takes longer, it's delayed. My clinical experience says it could take 30 to 45 days. I've had patients take as long as 74 days. So it varies by patient. So let's go through the whole arc of concussion here. So I've talked about this in a lot of videos where what do we expect for a concussion recovery? What is a concussion timeline? So in the research and kind of what Google is alluding to here, is this symptom arc. And so 3 to 5 days after your injury, we expect your symptoms to be their worst. And this usually checks out. So when I have a patient who was injured on Friday and I'm seeing them Monday, they say, I feel worse than I did on Friday and Saturday. And that checks out. It's 3 to 5 days after the injury. Usually that's when your metabolic deficit from the concussion is at its lowest. So your brain has the lowest energy. You usually have the most symptoms. 5 to 10 days after the injury is when symptoms usually start to resolve. And this only typically checks out for me, by and large, in my young male patients. So my 15-year-old hockey players, my 14-year-old soccer players. I typically see women, and anyone over the age of 18 usually takes a little bit longer than 10 days. I'm not saying that had to happen for you. It didn't necessarily happen for me, but that's kind of the arc that I see, is that if you're young and you're male, usually 5 to 10 days, you feel fine and you want to get back to your sport. And I've actually got to convince you to stay back a little bit because of this neurometabolic deficit that we know that occurs. But usually the arc is 3 to 5 days, you feel your worst, 5 to 10 days, you start to feel better. And then the range for dynamic exercise clearance for return to play, I've seen as fast as 19 days. So again, my young male hockey players or soccer players, can pass a Gapsky-Goodman, a Chicago Blackhawks test, some dynamic exertion protocol, where 19 days after the injury, they pass that, they're ready to return to contact practice, and it's usually 21 days before they're back on the ice or back on the field or the court or whatever. So let's break down, for not sports, let's break down just general concussion at large. How long should it take to recover? Because again, Google Bard is saying symptoms should go away within a week to 2 weeks. But then it gives this confusing point that says may last several weeks to several months for full recovery. So what does it look like? Again, studies and patient experience. So there's a 2020 study, I believe, I don't have it up anymore, but the title is something like less than half of all concussed patients recover in 2 weeks. And that's enough course, because we know that the metabolic energy deficit takes around 3 weeks, 21 to 30 days to recover, which is why we see that 21-day cutoff for sports-related concussion. But this study looked at, well, how long does it take people to recover? And they broke it down by age, but across all ages. So folks of any age, it takes around, or not, it takes around, we'll see around 77% of people will be recovered by 4 weeks. And in this study from 2020, I'll link it in the description after this is all posted. But recovery was defined as a post-concussion symptom scale of 5 to 6 or less, normal neurological exam, and normal exercise tolerance, meaning you can reach 80 to 85% of your heart rate max without concussion symptoms. So this, I would argue, is a pretty complete recovery. And we see that around 77% of people are going to recover in 4 weeks. We see that jumps up to around 94, 95% of people are going to be recovered in about 8 weeks. And then we see about 5.7%, 6% of people take longer than 8 weeks to recover. Now, I had a comment, I believe it was on YouTube, maybe it was Instagram, where it was on my video where I talk about this study in depth, where I say, hey, across the ages, and I show the graph, this is how long it takes people to recover. And this woman said, hey, it's been years, I don't see myself in your numbers. And I replied, yes, you're in the numbers, but it's hard to see because we're talking about weeks. Around 5 to 6% of people take longer than 8 weeks, and that could be months or years. So there was a 2022 JAMA study, which is Journal of the American Medical Association. So it's an open network study, so you can look this up. And we looked at middle-aged folks, so around 38 years old, plus or minus 15 years, who were presenting to the emergency department for concussion. So they had a normal Glasgow coma score. It was purely concussion, nothing else. They just happened to go to the ER because they were looking for help. And we followed these people out to see where was their functional recovery, or did they have a functional recovery? Were they back to their life, or did they have incomplete recovery, meaning they weren't back to their life, they still had symptoms, their quality of life was significantly impacted because they weren't recovered. And we followed them at 2 weeks and at 6 months. So at 2 weeks, how are you doing? And at 6 months, how are you doing? And we found that 73% of people, so 7 out of 10 people, had an incomplete recovery at 2 weeks. And we follow that out to 6 months, and we found that 56%, so 5 to 6 out of 10 people, still have an incomplete recovery at 6 months. So when Google's telling you, hey, most recovery takes around 10 days, might take several weeks to recover after that, but your symptoms should go away in 10 days, and you might recover several weeks to several months after that. We see that pan out in the research as 56% of people still have incomplete recovery, and their quality of life, meaning their ability to work, their ability to socialize with friends and family, their ability to have sex, their ability to shop on their own, to drive, is impacted in a way that is negative. It negatively impacts their life. So that's a big deal. And I think that's kind of what I wanted to bring up, is it's not abnormal to have symptoms for way long. And the problem is that doctors aren't really acknowledging it. So the clinical experience that I want to throw onto this, we got that 2020 study saying 77% at 4 weeks, 95% by 8 weeks, and around 6% of people are going to take longer than 8 weeks. We got that 2022 JAMA study saying 73% of people have an incomplete recovery at 2 weeks, and 56% have an incomplete recovery at 6 months. So I've worked with people from 24 hours after their injury to 7 years after their injury. And the difference between those folks is just how soon we intervene. A lot of times doctors say, hey, like this individual who's kind of sparked the idea for this whole live was, I've had symptoms for 28 days. And my doctor said it should take a few more weeks. Well, we know that your symptoms should have gone away within 5 to 10 days in a normal arc. So why are we not intervening? The Concussion in Sports Group, so the International Concussion Consensus Group, says that if symptoms last longer than 14 days in adults, or if symptoms last longer than 30 days in kids, it's considered post-concussion syndrome. So this idea that you've already made it to 28 days, whether you're a kid or an adult, you're approaching post-concussion. If you're an adult, you're in post-concussion. And to say just wait it out for several more weeks is neglecting the data that same international consensus group says, hey, we need an active recovery. And since 2016, so not quite 10 years, but almost a decade of research is saying, hey, rest is not a good idea. There was actually a really recent meta-analysis that I'll link in here where you've got the forest plot. So you've got a line here, and if a dot is on this side or a dot is on this side, it basically favors rest or favors exercise after concussion recovery. And you can see most of the dots favor an active recovery and only a few dots favor rest, because we find that the overwhelming amount of data say, hey, you shouldn't just rest and wait for your symptoms to go away. We need to actively intervene. There was a 2021 or 22 study, it was really recent, that found early prescribed aerobic exercise reduced the risk of post-concussion in adolescents by 48%. That's huge. So whether it's 3 days or 3 years, if you're working with me, you've had symptoms for 3 days or 3 years, we're still looking at the basics. We're still going to turn over all there's a video on this, and I've got blogs and things on this, but there's 5 reasons you're going to have symptoms after a concussion. Autonomic or blood flow dysregulation, you're getting too much or too little causing symptoms. Metabolic or hormonal disturbance, visual vestibular dysfunction, cervical spine issues, because you've always got to look at the neck, and psychological or trauma, anxiety, depression, PTSD, either before or in the family or around the injury can impact symptoms. And so whether it's been 3 days or 3 years, we still are going to turn over all those buckets so that we can take you from that 56% of people at 6 months or longer and get you into the group that should have recovered. So I don't see anyone with questions here, so I'll wrap this up. Basically, Google does not match patient experience, and patient experience is typically one that is kind of crying for more intervention, not to over medicalize it, but to basically say, hey, we actually need something to happen rather than you telling me to wait and hope the symptoms go away. Getting exercise testing within that first week, getting a visual vestibular evaluation, because honestly, that's part of the diagnosis of concussion, is to do a VOMS to rule it out from something else. Getting your neck looked at, because you can't sustain concussion without whiplash. The G-force just doesn't match up. And then just taking care of your mental health in there as well. So that is that, Google versus reality. I hope that kind of clarified some things. It's totally normal to have symptoms that last longer than what Google tells you. It's not normal, and it's not helpful, and it's actually against the evidence for your doctor to tell you to just rest and wait for those symptoms to go away. There's a ton that we can do as far as an active recovery to help you feel better. So I hope